Seniors over 60. Take these 3 vitamins for stronger legs fast. It's a common observation, and often a concerning one, that after the age of 60, many individuals begin to experience a noticeable decline in leg strength. Tasks that were once effortless, like standing up from a chair, can become a struggle, often requiring a push off the knees. Stair climbing, a routine activity for many, can feel akin to lifting heavy weights. There's also the unsettling sensation of occasionally losing one's equilibrium, even when simply navigating familiar spaces like a living room. While the easy assumption is that these changes are simply an inevitable part of aging, the reality is more nuanced and, thankfully, more manageable than many realize. This subtle weakening is frequently one of the earliest, yet silent, indicators of age-related muscle loss, a condition known as sarcopenia. This insidious process often occurs without any overt pain or swelling, gradually diminishing functional capacity until the point where external assistance might be needed to rise from a seated position. However, there is a significant and encouraging piece of good news. Scientific evidence has demonstrated that leg strength can be remarkably restored in a surprisingly short period, in some cases within just a few days, by addressing specific deficiencies in 3 crucial vitamins. This isn't about engaging in grueling exercise routines or undergoing expensive therapies. It's about providing the body with the right nutrients at the opportune moment. This comprehensive guide delves into the specifics of these 3 essential vitamins that every senior needs, explaining how deficiencies contribute to the debilitating feeling of heavy, weak legs, and outlining a safe and effective strategy for their replenishment to achieve a swift recovery. The information presented here is not based on anecdotal health gossip or unsubstantiated hearsay. Instead, it is grounded in robust clinical investigations, actual scientific research, and the collective professional experience spanning decades. As you stay engaged through this discussion, you will gain a thorough understanding of these vital nutrients. Furthermore, an effective vitamin regimen, one that many overlook but proves to be exceptionally potent, will be revealed, offering a practical path toward revitalized leg strength and overall well-being. As the years progress beyond 60, the human body undergoes a series of gradual yet significant transformations. The skeletal structure, once robust, becomes more susceptible to fractures, and the circulatory system, the vital network responsible for delivering oxygen and nutrients, begins to operate at a slower pace. Perhaps most critically for mobility and independence, the musculature, particularly in the legs, starts to exhibit a progressive weakening. It's a common scenario for individuals in this age bracket to remain unaware that their legs are often the first to signal this decline in strength. This subtle erosion of muscle mass can render even fundamental actions like standing from a seated position or ambulating across a room a considerable challenge, despite maintaining a seemingly normal diet and overall feeling of good health. The American Geriatric Society highlights that individuals over the age of 60 can lose anywhere from 1% to 3% of their muscle mass annually. This rate of loss, though seemingly small on a year-to-year basis, can accumulate significantly, meaning a person might lose as much as 15% of their leg strength within just 5 years without consciously realizing it. The question then arises, what are the underlying causes of this pervasive muscle weakening? There are 3 primary culprits that contribute to sarcopenia and its impact on leg strength. The first, and perhaps most influential, is vitamin deficiencies. As we age, our gastrointestinal tracts become less efficient at absorbing nutrients, and the production of stomach acid, crucial for nutrient breakdown, diminishes. This compromised absorption leads to suboptimal levels of key vitamins, including vitamin D, vitamin B12, and thiamine, often referred to as vitamin bone. These vitamins play indispensable roles in nerve transmission, essential for muscle activation and in muscle contraction itself. The second significant factor is a decline in blood circulation. When blood flow slows, the delivery of vital oxygen and nutrients to the leg muscles is reduced. This oxygen and nutrient deprivation manifests as early fatigue, frequent muscle cramps, and that characteristic sensation of heavy, exhausted legs. The third primary contributor is a decrease in physical activity. As individuals age, they may naturally walk less or opt to avoid activities like climbing stairs. This reduced usage leads to the eventual weakening and atrophy of leg muscles. Compounding this issue, muscles require the correct nutritional environment to regenerate and maintain their strength, and even regular movement cannot fully compensate for deficiencies in essential nutrients. The encouraging news, however, is that this decline is not a one-way street. By strategically replenishing these three deficient vitamins, it is indeed possible to restore lost leg strength, often within a matter of days. Let's embark on a detailed exploration of each of these vital vitamins, uncovering their specific roles and how they work to revitalize leg function. We will begin with the vitamin that is most often overlooked by seniors, yet acts as a critical switch for reactivating leg strength: vitamin D3. Vitamin D3, the master switch for leg strength. Vitamin D3 is far more than just another dietary supplement. It functions as a master switch, capable of reactivating the entire neurological, skeletal, and muscular system. The primary challenge many individuals face as they age, particularly after the age of 60, is a significant decline in their body's natural ability to produce this essential nutrient. Several factors contribute to this reduction. The skin becomes thinner, less efficient at synthesizing vitamin D from sunlight exposure. The liver and kidneys, organs crucial for converting vitamin D into its active form, experience diminished function, and many seniors simply spend less time outdoors, further limiting natural vitamin D production. Consequently, the body begins to experience a systemic shutdown of vital functions, leading to weakened muscles, that heavy feeling in the legs, slower movement, and, most alarmingly, a loss of equilibrium. This subtle deficiency in vitamin D3, a fundamental requirement for robust bodily function, is a primary driver of these debilitating symptoms. The profound importance of vitamin D3 extends beyond its role in bone health. While it is undeniably essential for aiding calcium absorption, which is critical for maintaining strong and healthy bones, its influence is far more pervasive. Vitamin D3 also plays a crucial role in ensuring that muscle fibers contract correctly, facilitating the smooth transmission of signals by the nerves and, critically, preventing muscle atrophy, the gradual wasting of muscle tissue that often goes unnoticed as we age. When vitamin D3 levels are insufficient, the body's systems become unreliable and weak, much like the aging machinery of an old vehicle struggling to perform. Identifying a vitamin D3 deficiency can be achieved by recognizing certain telltale signs. These often include noticeable weakness in the legs, particularly when attempting to ascend stairs, general fatigue that arises from prolonged standing or walking, nocturnal leg cramps, difficulty in turning or stepping rapidly, and persistent pain in the hips, knees, or heels. Some individuals may also experience more subtle, non-musculoskeletal symptoms such as mild anxiety, impatience, and difficulty falling asleep. These seemingly mild symptoms are, in fact, early indicators of vitamin D3 inadequacy, and they are frequently misattributed to the general process of aging. The scientific community has extensively documented the benefits of vitamin D3 supplementation in older adults. For instance, a study conducted by the University of Birmingham in the United Kingdom involved participants over the age of 65 who consumed 800 IU of vitamin D3 daily. Astonishingly, these participants demonstrated an average increase in leg strength of 19% within just a few weeks. Further research, published in a Chinese study, indicated that seniors who took a vitamin D3 supplement and engaged in minimal exercise experienced a significant improvement in both their leg power and balance. The findings from Harvard's Geriatric Research Center are equally compelling, revealing that older individuals with low vitamin D3 levels were a remarkable 40% more likely to experience falls or require hospitalization compared to their counterparts with adequate vitamin D3 levels. The message is unequivocal. Vitamin D3 is not merely a nutrient for bone structure. It is a vital protector of an individual's independence. The mechanism by which vitamin D3 restores leg function is multifaceted. It enhances the body's efficiency in absorbing calcium, promotes the development of new muscle fibers, improves the speed and responsiveness of muscle contractions, reduces latent inflammation within muscle tissues, and facilitates smoother, less painful movement. Essentially, when vitamin D3 levels are restored to their optimal range, it reactivates both the joints and the muscles, allowing them to function as they were designed. The recommended dosage for healthy individuals over 60 is generally between 800 to 1,000 international units (IU) daily. For those who have a history of falls or exhibit overt signs of frailty, a higher dosage of 1,500 to 2,000 IU per day may be advisable, always under medical supervision. For optimal absorption, vitamin D3 should be taken in the morning or early afternoon, and always after a meal that includes healthy fats, such as those found in salmon, eggs, or olive oil. It is crucial to avoid taking vitamin D3 immediately before bedtime, as it can potentially disrupt sleep patterns. Considering dietary sources alone, achieving adequate vitamin D3 intake can be challenging. For example, a 100-gram meal of fatty fish might contain around 500 IU, while a single egg provides only about 40 IU, and a glass of fortified milk offers approximately 100 IU. For most seniors, it would be unrealistic to consume such quantities of fatty fish, eggs, and milk daily to meet the recommended intake of 1,000 IU. Therefore, supplementation with vitamin D3 is frequently a necessary and highly effective strategy. Several groups should strongly consider vitamin D3 supplementation. If you are over 60, spend limited time outdoors, experience unsteadiness, or have a history of falls, have been diagnosed with osteoporosis, or suffer from joint pain, or follow a predominantly plant-based diet that is low in dairy and fish, then vitamin D3 should be a top priority. While vitamin D3 is generally safe, it is important to exercise caution regarding excessive use over extended periods. Consuming more than 4,000 IU per day consistently can lead to adverse effects, including headaches, constipation, nausea, elevated calcium levels that may result in kidney stones, and in sensitive individuals, irregular heartbeats. The key to reaping the benefits of vitamin D3 lies in adhering to the correct dosage, taking it at the appropriate time, and maintaining regular monitoring of your levels. Vitamin D3 is a crucial element in helping older adults regain their leg strength, acting as a vital switch to reawaken muscle systems that have subtly slowed down over time. When taken correctly, the positive effects can be noticeable within days, manifesting as stronger legs, lighter steps, and a profound increase in confidence with every movement. It is a cornerstone for restoring balance, nerve health, and leg confidence. Vitamin B12, the conductor of nerve and muscle coordination. Let's now turn our attention to vitamin B12, a nutrient that is both critically important and frequently overlooked, particularly for individuals over the age of 60. While many are aware that B12 plays a role in memory and overall vitality, its essential function in mediating communication between the brain and the muscles, especially those in the legs, is often underestimated. Vitamin B12 is paramount for maintaining healthy nerves, ensuring coordinated movements, and supporting quick reflexes. When B12 levels begin to dip below optimal, this vital connection between the brain and muscles becomes hazy, and it is frequently in the lower extremities, specifically the legs, that the initial symptoms manifest. The consequences of insufficient vitamin B12 levels can be varied and insidious. Individuals may experience symptoms such as a burning, tingling, or numbness sensation in their feet, a generalized weakness in the legs that becomes particularly apparent when standing or walking, and a feeling that the legs are unresponsive or asleep. This can translate into significant trouble with balance, even on stable, level ground, leading to a pervasive sense of unsteadiness or a need for external support when walking. Beyond these motor symptoms, some individuals also report experiencing mood swings, mild depression, forgetfulness, and what is commonly referred to as brain fog. These symptoms often develop gradually, leading many seniors to conclude that they are simply a natural consequence of aging, when in fact, they are classic indicators of a vitamin B12 deficiency. The prevalence of B12 deficiency among seniors is attributed to two primary factors. Firstly, there is inadequate absorption. As the body ages, the production of stomach acid decreases, a process that can be further exacerbated by the use of medications that reduce stomach acid, such as ranitidine or omeprazole. In this low-acid environment, it becomes significantly more challenging for the body to extract vitamin B12 from dietary sources. Secondly, dietary restrictions contribute to the problem. Vitamin B12 is found almost exclusively in animal products like meat, fish, eggs, and dairy. Individuals who consume less meat or adhere to a predominantly plant-based diet are at a higher risk of deficiency, even if their overall diet is considered healthy, because their bodies may not be able to absorb sufficient quantities of this vitamin. Scientific consensus strongly supports the link between inadequate B12 levels and mobility issues in older adults. A study conducted at Oxford University in the United Kingdom found that individuals aged 65 and older with low B12 levels exhibited significantly slower walking speeds, much poorer balance, and were more than twice as likely to experience a fall within the subsequent year compared to those with normal B12 levels. A randomized clinical trial published in the Journal of Gerontology further investigated the impact of B12 supplementation. In this study, participants were given 1 to 2 milligrams of vitamin B12 daily for 8 weeks. Following supplementation, participants reported a notable reduction in numbness and instability, improved lower body strength, and faster reaction times. Beyond its impact on cognitive clarity, vitamin B12 is crucial for maintaining bodily balance and control. The way vitamin B12 functions within the body is critical for motor function. It plays a vital role in the formation of myelin, the protective sheath that surrounds nerve fibers. This myelin sheath acts as an insulator, allowing for the rapid and efficient transmission of electrical signals. Furthermore, vitamin B12 is essential for red blood cell production, which ensures an adequate supply of oxygen to muscular tissues. It is also a key player in energy metabolism, facilitating the quick and precise signaling from the brain to the muscles. Therefore, muscles receive the necessary energy to function effectively. When a deficiency in B12 occurs, the nerve communication system falters, leading to misinterpretation of signals by the muscles, and consequently, the legs begin to feel disconnected and weak. Certain groups are at a higher risk of B12 insufficiency. If you are over 60, regularly use antacids or acid-blocking medications. Follow a diet low in meat or primarily vegetarian. Take metformin and have diabetes. Suffer from digestive disorders such as gastritis or IBS. Consume alcohol regularly or have undergone weight reduction or gastrointestinal surgery. You are more likely to have low B12 levels. In such cases, it is highly advisable to undergo a simple blood test to ascertain your B12 status. It is important to be aware of the less commonly recognized indicators of B12 deficiency. Some individuals may not experience the typical tingling or numbness, but instead become unusually clumsy, frequently drop objects, suffer from mild headaches, or experience persistent fatigue that does not improve with rest. Sporadic pains or a buzzing sensation in the feet can also be warning signs that the body is attempting to communicate a deficit. The sooner these indicators are recognized and addressed, the quicker and more complete the recovery will be. The recommended daily dosage of vitamin B12 for individuals over 60 is typically between 500 to 1,000 micrograms mcg of methylcobalamin. Methylcobalamin is preferred because it is the active form of vitamin B12, meaning the body can utilize it immediately without needing to convert it. This is particularly beneficial for seniors as the body's conversion rates tend to decrease with age. Vitamin B12 supplements are available in various forms, including chewables, sprays, and sublingual tablets that dissolve under the tongue. It is best to take B12 in the morning or with lunch, as coffee and tea can interfere with its absorption. While it is theoretically possible to obtain sufficient B12 from diet alone, in reality, it is improbable for most. For instance, 3 ounces of beef liver contain around 70 mg. 3 ounces of salmon provide about 4.5 mg. A single large egg offers merely 0.5 mg, and a cup of milk contains around 1 mg. To meet the recommended daily intake through food alone, one would need to consume substantial quantities of these items daily. Therefore, for the majority of seniors, a supplement represents a more practical and reliable option. Vitamin B12 is water-soluble, meaning any excess is efficiently flushed out of the body. This makes it exceptionally safe, even at high dosages, for healthy individuals. There is no known lethal amount of B12. However, if you are taking blood thinners or have chronic kidney problems, it is advisable to consult your doctor before starting supplementation. Otherwise, B12 supplements are among the safest and most effective means to enhance energy levels, improve nerve function, and regain control over one's legs. Many individuals report feeling more steady when walking, regaining sensation in their feet, standing up with greater confidence, and even experiencing improved sleep once their nerve symptoms subside. Vitamin B12 is truly a movement vitamin, as well as a brain vitamin, re-establishing the crucial connection between the body and brain, leading to stronger feeling legs, quicker muscle responses, and a welcome return of confidence. If you've been experiencing unusual sensations, limb weakness, or balance problems, it is essential not to disregard them. Checking your B12 levels and providing your nerves with what they desperately need can make a profound difference. Vitamin bone, thiamine, the engine of muscle energy. While you may already be familiar with how vitamin D3 contributes to muscle building and how vitamin B12 facilitates nerve-to-leg communication, there is one more crucial piece to this puzzle, and that is thiamine, also known as vitamin bone. This vitamin provides the essential electricity, or more accurately, the real energy that your muscles require to function. If vitamin D3 is like turning on the lights and B12 is like connecting the communication lines, then without vitamin bone, your muscles simply cannot operate. Even with strong bones and sharp nerves, your body will run out of fuel if thiamine is lacking. What exactly is vitamin bone, and why is it so critical? Thiamine, or vitamin bone, is indispensable for energy metabolism. Its primary role is to assist in the conversion of food, particularly carbohydrates, into ATP, adenosine triphosphate, which is usable energy for the body. Every single movement, every breath, and every muscular contraction is powered by ATP. Given that the legs contain the largest muscles in the body, they require a consistent and substantial supply of this energy. When thiamine levels are low, muscles feel heavy, fatigue easily, and struggle to recover from any physical exertion. The early signs of a potential vitamin bone deficiency are commonly described by individuals over 60, even with minimal activity. These can include legs feeling weak or excessively tired, cramping in the muscles, particularly in the feet or calves, a dragging, heavy sensation when moving, experiencing shortness of breath when climbing stairs, and occasionally feeling lightheaded or dizzy after standing up. Mental fatigue can also set in, characterized by a lack of drive to move and an overall lack of motivation. These are typical indicators of a slowed muscle metabolism, and thiamine often plays a significant role in addressing these issues. Several factors contribute to thiamine deficiency in the elderly. Firstly, there is a reduction in absorption. The digestive system's ability to absorb thiamine from food declines with age. Secondly, the use of certain medications can deplete thiamine levels. Diuretics, often prescribed for heart problems or high blood pressure, can cause thiamine to be flushed out through the urine. Antibiotics and metformin can also negatively impact thiamine levels. Thirdly, alcohol consumption, even in moderate amounts like wine or beer, can impair the body's ability to absorb thiamine. Fourthly, a poor diet can be a factor, as thiamine is often removed from highly processed foods. Additionally, if a person is consuming fewer whole grains or legumes, their intake of thiamine can be insufficient. Research provides compelling evidence of thiamine's impact. A 2021 study from Tokyo University found that over 30% of the 300 older participants had low thiamine levels. These individuals also exhibited significantly less leg strength, moved more slowly, and frequently reported muscle weariness. Following thiamine supplementation, most demonstrated a noticeable increase in energy, walking distance, and stair climbing ability. Another study published in the Journal of Neurological Sciences involved patients with persistent leg fatigue who received 100 milligrams of thiamine daily. After 7 days, 82% reported improved endurance and 68% reported reduced heaviness and leg pain, with no adverse effects observed. In what ways does vitamin bone specifically support leg function? Thiamine powers the Krebs cycle, the body's primary energy-producing mechanism. This allows muscle cells to generate ATP more rapidly, recover from movements more quickly, and maintain their strength and tone throughout the day. Furthermore, thiamine facilitates the transmission of nerve signals, particularly in the peripheral nerves that control the legs and feet. In essence, without adequate thiamine, it's akin to trying to operate a car without fuel. Nothing moves, even if all other systems are functional. The recommended daily dose of thiamine is relatively small, 1.2 milligrams per day for men and 1.1 milligrams per day for women. However, for therapeutic benefits, significantly larger doses are often utilized in older adults experiencing symptoms. Doctors frequently advise seniors with nerve problems, fatigue, or leg weakness to take between 50 to 100 milligrams daily. The good news is that thiamine is water-soluble, meaning any excess can be safely eliminated by urine. The optimal time to consume thiamine is in the morning to help boost energy levels throughout the day. It should always be taken with food, preferably a meal that contains some healthy fat or protein. It is advisable to avoid taking it with alcohol, coffee, or black tea, as these substances may hinder absorption. While thiamine can be obtained through diet, one must be deliberate. Excellent dietary sources include whole grains like brown rice or oats, legumes such as beans and lentils, sunflower seeds, and organ and pork meats. However, the majority of seniors do not consume enough of these foods on a daily basis, and certain medical conditions or medications can interfere with absorption. Therefore, a supplement can often be a more practical solution. Individuals who should consider taking thiamine supplements include those with type 2 diabetes, who consume alcohol regularly, who take diuretics, metformin, or acid-blocking drugs, who experience leg fatigue even with light exertion, or who have experienced unexplained weight loss or appetite loss. Thiamine is known to be safe and is regarded as one of the safest supplements for senior citizens, even at higher dosages. However, as with any high-dose supplementation, it is always prudent to consult with your physician, especially if you are on medication or have liver or kidney issues. The actual results reported by many seniors are remarkable, feeling more energized after just 3 to 5 days of taking thiamine, experiencing lighter legs, finding it easier to walk, experiencing less strain when climbing stairs, and regaining a natural desire to be active and move. This is analogous to adding fuel to an engine that has been sputtering for years. While vitamin B12 might not garner as much attention as D3 or B12, it can be the crucial component that makes all the difference for older individuals experiencing energy-related issues, muscle fatigue, or leg heaviness. It powers your muscles, restores your drive, and provides you with the strength, purpose, and ease to navigate your day. If you feel exhausted, weighed down, or disconnected from your body, do not overlook thiamine. The simplest nutrients can sometimes yield the most profound impacts. Synergistic combination, optimizing the power of 3 vitamins. Now that you have a comprehensive understanding of the distinct yet complementary roles that vitamin D3, vitamin B12, and thiamine play in supporting your muscles, the logical next question is how to effectively combine these nutrients for optimal benefit. The key to success lies in understanding the principles of timing and simplicity. Let's begin by addressing the optimal timing for each vitamin. Vitamin D3, being fat-soluble, is best absorbed in the morning, immediately following breakfast. This is particularly true if your breakfast includes a fat-rich meal, such as yogurt, eggs, or a small portion of avocado, as the dietary fat enhances D3's absorption. For vitamin B12, early afternoon or midday is generally considered the most effective time to take it. Since B12 also promotes alertness, taking it too late in the day might lead to sleep disturbances. Furthermore, avoid consuming it with tea or coffee, as these beverages can impede its absorption. Vitamin B, or thiamine, serves as your morning fuel. It should be consumed with your first meal of the day, preferably a healthy breakfast that includes whole grains and some protein. This will support your energy levels throughout the day and even aid in improving focus. To illustrate a simple, effective daily regimen, for breakfast, consider a small bowl of Greek yogurt, 1 boiled egg, 1 vitamin D3 capsule, and 1 vitamin bone, thiamine, tablet. For lunch, a meal consisting of steamed vegetables, grilled salmon, or tofu, along with 1 vitamin B12 tablet or lozenge would provide the necessary nutrients in the right amounts at the right times. When considering multivitamins, it is essential to read the label carefully. Many senior-specific formulas may underdose these critical nutrients. Ensure that any multivitamin you choose contains adequate amounts of thiamine, B12, and D3. It's also important to remember that certain multivitamins contain both water-soluble and fat-soluble vitamins. Therefore, it is still recommended to take them with meals, preferably at lunch or in the morning, and never on an empty stomach. Finally, and this cannot be stressed enough, it is not always beneficial to take more. Always consult your doctor or pharmacist and adhere to prescribed dosages, especially if you have a chronic illness or are taking other medications. When taken as directed, these 3 vitamins work harmoniously, like a well-oiled machine, to restore strength, balance, and vitality, not only to your legs, but to your entire life. Safety, precautions, and crucial cautions for vitamin use. Like any powerful tool designed to enhance health and vitality, vitamins must be used with care and awareness. For individuals over 60, adhering to specific safety precautions when heading to the drugstore or pharmacy is paramount. First and foremost, resist the urge to self-adjust dosages. The principle of more is always better does not apply to vitamins, even natural ones. Taking double or triple the prescribed dose will not yield faster results. In fact, it can be detrimental. For instance, excessive intake of vitamin D3, a fat-soluble vitamin, beyond 4,000 IU per day without supervision can lead to dangerously high calcium levels. This can manifest as kidney stones, constipation, nausea, or even disorientation. Secondly, exercise caution if you have pre-existing kidney or liver conditions. These organs are responsible for metabolizing and eliminating excess vitamins from your body. If they are not functioning optimally, even standard dosages can accumulate, leading to adverse effects. Therefore, before embarking on any supplementation regimen, particularly with fat-soluble vitamins like D3, it is imperative to consult your physician if you have been diagnosed with chronic kidney disease, fatty liver disease, or any other serious ailment. Thirdly, it is easy to overlook subtle adverse effects that can arise from vitamin use. For example, while rare, prolonged high-dose use of vitamin B6 can lead to tingling or numbness in the hands and feet, especially if misuse is unmonitored. Similarly, excessive vitamin D3 can cause headaches, muscle cramping, or a poor appetite. Vigilance for any minor changes in your mood or physical sensations, particularly after initiating a new vitamin, is crucial. Lastly, consider periodic blood level testing. If you are taking vitamin D3 or B12 long-term, getting a basic blood test every 6 to 12 months is a wise practice. This ensures that you are not inadvertently taking too much or too little, and that your levels remain within the safe and effective range. In conclusion, while vitamins can undoubtedly elevate your quality of life, the secret to their efficacy lies in being informed, wise, and cautious, especially as we age. These three simple nutrients possess the power to profoundly transform your strength, mobility, and independence when administered correctly. Let's revisit the core message. The leg weakness, unsteadiness, heaviness, or general fatigue you may be experiencing is not necessarily an irreversible consequence of aging, nor is it merely a figment of your imagination. As we've explored, vitamin D3 fortifies your bones and muscles, vitamin B12 enhances your nerve function and balance, and thiamine, vitamin bone, replenishes your energy and stamina. These three fundamental vitamins, when working in concert, create a potent synergy that can help you reclaim your strength, your confidence, and your freedom of movement. The crucial step, however, is to initiate action, whether it involves monitoring your blood levels, committing to a daily supplement regimen, or consulting with your doctor. Proactive engagement is always preferable to passive waiting. Your personal experience and insights are invaluable. Have you tried any of these vitamins? Did you notice a significant change in your overall energy, strength, or balance? By sharing your stories in the comments section, we can learn from each other and grow stronger together. Thank you for watching. Take good care of your body, fuel your legs, and continue to stride forward, one powerful step at a time.